In the emergency room, seconds matter. A patient lies unconscious. Blood sugar is low. The syringe is ready. Glucose. But wait. What if that life-saving glucose could silently damage the brain? One small step can mean the difference between recovery and irreversible neurological injury. Tonight, we uncover why thiamine must come first. Inside every cell of the body, glucose is fuel, but fuel alone is useless. It needs a key. That key is thiamine. Thiamine, vitamin B1, activates critical enzymes: pyruvate dehydrogenase, alpha-ketoglutarate dehydrogenase, trans-ketolase. Without thiamine, glucose cannot enter the Krebs cycle. It cannot produce energy efficiently. Instead, it turns into lactate. Acid builds up. Cells suffocate in metabolic failure. And the organ that suffers first is the brain. The brain consumes enormous amounts of glucose. But without thiamine, neurons starve. Energy drops. Mitochondria fail. Certain regions become vulnerable. The mammillary bodies, the thalamus, the periaqueductal gray. This leads to a devastating condition: Wernicke encephalopathy. Its classic triad: confusion, ataxia, ophthalmoplegia. But here's the frightening truth. Not all patients show all three. And if missed, it can progress to permanent memory loss. Korsakoff syndrome. Irreversible. Who are the silent victims? Patients with chronic alcohol use, malnourished individuals, those with prolonged vomiting, bariatric surgery patients, severe liver disease, refeeding syndrome risk. Their thiamine stores are already depleted, and when we suddenly give glucose, we increase the demand. Like pouring fuel into an engine without oil, the damage accelerates. This is why medical practice teaches: in at-risk patients, give thiamine before glucose. Typically 100 to 300 milligrams intravenously. If Wernicke is suspected, high-dose therapy, up to 500 milligrams IV. Because thiamine is safe, inexpensive, and life-saving. One small injection can prevent permanent brain injury. But remember this carefully. If a patient is critically hypoglycemic, seizing, or unstable, do not delay glucose. Correct hypoglycemia immediately. Then administer thiamine as soon as possible, because in medicine, priorities matter. And one more crucial detail. Thiamine cannot function properly without magnesium. Magnesium is required to activate thiamine-dependent enzymes. So in critically ill patients, check magnesium, correct it, complete the metabolic puzzle. In medicine, sometimes the most powerful interventions are not the most dramatic. A small vitamin, a simple decision, a few seconds of thought. Before glucose, give thiamine. Because protecting the brain means protecting the future. And sometimes the smallest molecule prevents the biggest tragedy.